Her.ie is on a little road trip today. We're in Limerick City at the Otto Clinic to try out the much talked about Vampire Facelift. Before I go under the needles, we're going to have a chat with Managing Director of the Otto Clinic, Ita Murphy, to see what all the fuss is about.
We've heard an awful lot about the Vampire Facelift, I suppose. In the last year in particular, it's become a real beauty buzzword. But you guys at the Otto Clinic are doing it a lot longer than that.
We are indeed. We're doing it since 2006 and we were the third in the world to do this treatment. Dr. Kubota in Japan was the first in the world. He's a plastic surgeon and he discovered really that platelet rich plasma treats the skin, and the skin in the area that he treated was far superior to the skin in the rest of the face. So that's where it has come by, and it's now brought down to where we can do it very, very simply, just taking 10 cc's of blood and then spinning it down in a centrifuge and using the 7 cc's of platelet rich plasma. So it's very, very effective.
So when I'm done here now, what's my skin going to look like? Do I have downtime? Do I need to hide myself away in a dark room for a few days?
Certainly you'll have a certain amount of swelling on your skin. You can put makeup on straight away afterwards, and we often use Glycogel, which is a camouflage makeup, which also has antioxidants in it, and it feeds heals the skin as well. But really you'll be a little bit swollen for 12 to 24 hours. You may and may not get bruising. We find an awful lot of clients that come here do not get bruising, but it is a risk that you take. And you'll see yourself initially, you'll kind of think, oh gosh, it's a bit swollen and it's not me. You look as if you've been crying. Put on your sunglasses and away you go, you'll be fine.
I've got the big sunnies today. I'll be fine,
yeah.
no problem there.
Absolutely.
And then how soon afterwards can you expect to see a difference in the skin, the results of having had the facial?
Usually it's about, like at your age now, you'll find it really after 3 to 6 weeks. Generally we say 3 months because it takes 3 months for the actual platelets to grow the collagen in the skin, and the growth factors within the platelets are the most important component of your blood, and they heal the skin. So it's very, very effective on scar tissue as well, you know, for acne scarring or anybody who would have a scar. So you're talking about 6 weeks to 3 months, and then you can just expect to have really bright eyes, fresh, bright skin, and it's just glowing. Okay, so the first thing I think we'll do is just very, very finely, we're going to inject the upper lid of the eye. And this is going to help to tighten the eyelid, because sometimes we find, particularly as even, you know, in our early 30s, we can start to get that loose skin over the eyelid. So this is going to help to tighten the eyelid so that when you're putting on your eyeshadow that it goes on much smoother. We're now going to inject under the eye, and this helps to improve the dark circles and also put back in the fat pad, because it's under the eye, that's where you lose the fat first in your face, which is strange enough, but that's where you lose it. And also the blood supply to that area becomes diminished as we get older. So we're just going to inject very little around under the eye to improve the lymphatic drainage and improve the fat pad under the eye, which gives you, the result from that then will be brighter, fresher and tighter looking eyes, just bigger eyes. For the area down around the chin area, what we can do is, it's actually not bad at all, but what we might do is just go in underneath. If there's any slight little bit of scarring maybe that you might have had when you were younger with acne or whatever, we'll just inject a little bit deeper in there to break up the scar tissue, and we'll inject in on the top of it as well. This will also help to maintain this area of the skin. Another area that some people like to have done, but you certainly don't need this, are your lips. And you can inject the lips. It's a little bit more painful to inject the lips, but it does improve the moisture content in the lips. And it doesn't make them really, really big, but it just helps to outline them and keep them very...
that sounds lovely.
Yeah, it does.
That sounds very nice.
We can do that too. And another area here again are the nasolabial folds. Now again, yours are absolutely perfect, but what we can do is just maintain the strength in them again, so that you get an overall appearance of freshness and volume in your skin.
So here I am back in her.ie Towers 2 weeks after my Vampire Facelift. If it was good enough for Kim Kate, I figured it was probably good enough for me. But I will say I was quite nervous going in. That was the beauty of visiting the Otto Clinic. Ita couldn't have been any nicer to me. And the consultation really made me feel like it didn't matter whether I decided to go for it or not. I was getting a proper talk through of what my skin looked like, what it needed, and how I could benefit from having the procedure done. The procedure itself was a little bit painful. There's no point lying about it. It was a little bit uncomfortable. I suppose you have to expect that going in. There is injections into your skin. However, I was prepared for something a lot more painful, and it was over in minutes once it had actually begun. After the procedure, I could see that I had considerable swelling around my eyes, and my lips kind of looked like I'd gotten a little bit of fillers in there. So it was a case of big shades and a nice big scarf, and walked around Limerick for an hour afterwards looking like a celebrity who was trying really hard not to be noticed and failing miserably. Within one day, all of that swelling had pretty much gone. I had a tiny little bruise under my right eye, and I had been warned ahead of time that if I was at all prone to bruising, that I might have a little bit. It was very easily covered by makeup, and it was gone within a couple of days. It says that about 3 months are necessary to see the full effects of having the treatment done. It's only 2 weeks later now, and I can already tell that there are some benefits to it. My skin definitely looks brighter and feels better, and I've had people actually comment on my skin and how well it looks at the minute. There's parts of my skin where I'm generally quite prone to blemishes, and I've noticed far less so in the 2 weeks since, and I'm really looking forward to visiting the Otto Clinic again in a couple of weeks just to see the before and after pictures that Ita has kindly offered to send on to me, and it's part of the service for every client. You're in very, very safe hands in the Otto Clinic, and I would not hesitate to recommend Ita to anyone who's interested in getting it done. The thing I learned from visiting is get your consultation. You're not going to be under any pressure either way to actually decide whether you want to have the treatment done or not, but you'll learn an awful lot more about your skin, how you could benefit from it, and then it puts you in a position apart to decide whether this is really the treatment for you or not. The other good news is 2 weeks later, and I have not turned into a vampire myself yet.